beauty of home care is that it's completely customized to the person receiving the care. So we have the opportunity for a nurse to come out and do an assessment, really identify what their needs are, and then of course what they might need help with around the house to keep them safe at home.
Welcome back to the Move Room. My name is Catherine Reber, and I'm a doctor of physical therapy working out of Kinetic in Westchester, Pennsylvania. And today I'm joined by Christine McGovern, who is the owner of Options for Senior America. And this is a franchise business, and they specialize in non-skilled in-home adult care. And they span across 5 different counties in the southeastern Pennsylvania region. So Christine, thank you so much for joining us today.
Thanks for having me. It's a pleasure to be here.
Of course. So give us a little background. How did you end up getting into this field, in this business?
Yeah, so it was quite a journey. I started off in financial services and did that for about 28 years, working mostly with individuals, doing personal financial planning, portfolio management. Around the time of COVID, when a lot of people were starting to question just their careers, what they were doing, I started to think about what I wanted to do for the last 10 to 15 years of my career. And I wanted to do something that I could really make an impact in people's lives and then also have a little bit more autonomy than, going to an office 9 to 5 every day. And right around the time I was starting to think about what I wanted to do, my dad ended up in the hospital with late stage congestive heart failure, did not want to go to rehab, and basically checked himself out. And so it was the two of us for pretty much 2 months, because it was during COVID. I was able to spend that time with him for those 2 months. And I was really 24/7 his caregiver, doing everything for him. And the benefit to that was not only the amazing time that we had together, but also just seeing firsthand how much having that one-on-one attention can really help someone not only mentally, but physically recover. And after those 2 months, he was able to live by himself, back driving for 3 more years after that.
Wow.
I don't know how it would have turned out otherwise, but that experience really solidified my decision to go into home care. And then, just started looking at how I would do that, if I would do it by myself or open a franchise. And I liked the idea of the franchise model where you just, you pretty much have a playbook. And then I looked at a few different franchises, ran into Options for Senior America, and just loved that they had a 35-year history. They really knew the space. They pioneered the live-in option, which I'm sure we'll talk about, in a little bit, but just really loved the fact that they were leaders in the space. And the owner started the company because he had, struggled with finding care for his mom who had a stroke. So we kind of had similar stories, and that was kind of how I landed on home care and Options for Senior America.
Absolutely. And I think this is such a big thing for people because, I've even seen it through my own family, when their, parents or grandparents get older, they're kind of at that spot of, okay, where are we going with this? Are we putting them in a nursing home, a skilled facility? Do they even need a skilled facility? And what are our options there? And I think maybe some people don't even know that is an option, to be able to just have somebody there to help you kind of with your just basic activities of daily living and just have a companion, right? I think even from a mental capacity, that's really helpful to have your parent, grandparent, whoever it may be, just to have someone there to talk to and just provide some companionship as well.
Yeah.
Now, were you living at your dad's home or was he living with you?
I actually went to Florida to stay with him for 2 months. So that was another challenge that I had that a lot of other families face, where as a child, you want to be the caregiver. You want to be that person to help your parents with everything they need. But a lot of times you can't, because maybe you live in a different state, you have your own children, you have a job that isn't super flexible. So I did have, really through COVID, I had the opportunity to go there and stay for 2 months. But fast forward to, unfortunately, my dad did pass away in May of 2025. And for the last 2 months of his life, I wasn't able to be there because my daughter was graduating from nursing school. My son was just finishing up school, and my husband was working and traveling. So I was able to send one of our live-in care providers to stay with him for 2 months. So a lot of times we say, would we in fact have this caregiver take care of our own parents? That's kind of our final, do we hire this person or not? And we definitely would. And I did. And it was just a wonderful experience for him and the peace of mind for myself.
So true. That's, if you're the owner and you can trust one of your own colleagues to be able to work with someone that you love, that's a huge testament to what the work that you guys do.
Yeah.
So how big is Options? And is it primarily just in the Eastern region, or are they national? What does that look like?
Yeah, so they are a national franchise. We have, I want to say, about 13 franchises. Some of them are, a few of the offices are corporate owned, kind of the Maryland, Virginia area, North Carolina. I think there's one in Nashville area, Tennessee, or Louisiana, I'm sorry. Gotcha. And then we have Florida, a couple in Florida, us in Pennsylvania. There's one in Harrisburg, Pennsylvania as well. We're kind of right outside of Philadelphia, the Wayne area. So they are national, and there's quite a few different franchises.
How many people do you have employed under your specific franchise?
We have a gentleman that does recruiting. We have a care coordinator. I have a sales and marketing person, an admin person, and then myself. So there's 5 of us.
Amazing.
Total.
And then how does it work for the caregivers? Are they like an independent contract, or how does that work?
Yeah, so right now our caregivers are independent contractors. That was the model that we assumed when we started the franchise. We are really looking into moving to a W-2 model, so we'll probably end up doing that by the end of the year. For most cases, our caregivers do work for other home care agencies. They work other jobs. The families direct a lot of the care that they do. So in all purposes, they really are considered independent contractors. But I think just the way the world's moving, I think W-2 employees seem to be more of the norm in the home care space.
Gotcha. And how many of these independent contractor caregivers do you have at a time in the business?
So we have about 50 on our roster and about 25 that are working day to day in homes on cases right now. So we have a large pool that we can pull from if, someone might call out sick or have a vacation scheduled, an emergency. We have a nice stable of caregivers that have already been vetted and are pretty much ready to go.
Sure. So you started your franchise in 2021. Do I have that correct?
Yep.
Okay. And that was right kind of mid-COVID. So how did COVID affect you being able to open the franchise? And was it hard to kind of get clients essentially to work with?
Yeah, so it took a little bit longer in terms of getting our home care license, just because, as you know, everything was kind of shut down. People weren't in the office as much as they used to. So things that maybe normally took a month took 2 months. But once we got the license, it was actually a great time to be in home care. And interestingly, all through COVID was a great time to be in home care, because that was the time where people didn't want to be in facilities. They were nervous being in these large organizations or, facilities with so many people, and then the nurses going from room to room, or the caregivers people were just so scared of human contact. If you remember, we were, locked in our houses and washing down our groceries and all of that. So having someone come into the home was actually something that a lot of people felt more comfortable with, because it was just you and the caregiver. And a lot of our live-in cases, they pretty much just locked down together, and that was, their unit.
Yeah, I didn't even think about that, because I think, everybody at that time was having like a couple people in their household, and then that was it. Like, you were really exposed to the outdoor world. So
Right.
Of course that was probably nice to have, if it was your parent or something, to have them with somebody so that that they're safe in a manner, right? They're able to get things done with that person, and they're not alone at all times, because I think some of those bigger facilities were probably a nightmare during that time with all the sickness going around. Absolutely.
Yeah, just the fear, because there was so much fear of the uncertainty and not knowing what was safe, what wasn't safe. So it just seemed safer at the time to be at home.
Right. So tell me about the day-to-day. Like, what do the caregivers do? So because I know you do have the live-in option. So Can you talk to me a little bit about kind of the model that you guys have?
Yeah. So our caregivers, the beauty of home care is that it's completely customized to the person receiving the care. So we have the opportunity for a nurse to come out and do an assessment of the care recipient, really identify what their needs are, not only from a physical standpoint, but from a mental standpoint. And then, of course, just what they might need help with around the house to keep them safe at home. So we have caregivers that come in and are really just companions. They'll help with meal preparation, medication reminders, taking people to the doctor or their favorite, hair or nail salon,
Sure.
getting their nails done if they're not driving anymore, or they just don't feel comfortable to drive by themselves. Changing the sheets is always something that's really complicated for me, let alone, when you're 80 and you're trying to get that,
this sounds
mattress
nice. I feel
pad
like I
on.
need somebody.
Yeah, it's a real challenge. So they can kind of do that. The laundry. We even have care recipients that like to cook, or they like to sew and, do crafts and things like that. So we'll have the care providers help them cook. They'll send me pictures of things they've made, or, even care recipient teaching our caregiver how to knit or sew or things like that. So it not only provides that physical help at times, but sometimes it's just really an emotional connection that they have and that they need to keep them, home. And then, of course, we have our care recipients that need more help. Maybe they can't bathe by themselves. They need help getting dressed, trying to get those compression socks on, to help their heart conditions, grooming, anything. Some need help, toileting, feeding even. We have people that are completely bedbound, and so they need to have a bed bath. They need to be turned every couple hours. They might have a catheter that needs to be emptied and changed. And so our caregivers can really do anything from companionship all the way up to full care for someone that's bedbound.
So it could be one of those things, like even from a medication standpoint or PT standpoint, OT standpoint, where like they may have their set of medications and you're just making sure that they're taking the right ones based on their prescriptions, right? Like it's different from the skilled manner of like, okay, I'm going to prescribe you this, right?
Yep.
Is that correct?
We don't prescribe any medication, and we actually aren't allowed through our license to fill pill boxes or to take medication out of a pill container. So there are pharmacies that do pre-filled packs, or usually it's a family member that'll fill the pill box, and then we just make sure that they're taking it at their specific regimen.
Understood. So if a family calls you and they're looking to utilize your services, what does that look like? Like, who are they talking to first in order to kind of start to make that connection?
Yeah, so most of the time, the people who call us are the family. It's usually the daughter or the son. Every once in a while, we'll get a senior calling us for their spouse or maybe for themselves, but mostly it's a family member. And we are, phone comes right to myself or someone else in my office. It's usually me that will answer the phone, on the first or second ring. And we just really do an intake is what we call it, where we understand like what's going on with your loved one, what prompted you to make this call, what exactly type of help they need. And we'll kind of go through all the, kind of just initial information. And then we'll try to schedule a home visit so we can actually go out, see the home, meet the family, meet the care recipient, get an idea of their personality, make sure things are safe in the house, that they have, a shower chair if they need it, or grab bars, there aren't any tripping hazards, things like that. And once we get to know the family and the condition of the care recipient, then we'll start to think about like all those 50 people on our roster and, who's able to work those hours, who lives close by, who has a specialty in dementia, really understanding what they need and then aligning the right person for them. And then we would go and do a meet and greet so the family could meet the care provider, make sure it seems like a good fit, from a personality perspective. And then we go ahead and assign them to the case and go from there.
Have you ever run across a challenge where maybe somebody starts off with a caregiver and they do have all the specialties that they need to be able to stay with that person, but maybe their personalities don't mix? Has that occurred? Because I'm sure it would, right?
Yeah, definitely. And, usually we'll say, let's give it, a week. Just make sure, because we're getting to know you and you're getting to know us, and it might take a little bit to get a jive. And we, knock on wood, we haven't had a lot of situations like that, but every once in a while, a lot of our caregivers come from other countries and they might have an accent and the care recipient's hard of hearing. And it just becomes very frustrating or challenging for them because, there's nothing wrong with the caregiver. Their skills are great, but they can't understand them.
Mm-hmm.
And so that can be frustrating. So yeah, we will just go ahead and switch out the caregiver and try someone else. We just had that actually yesterday, where we had a family call us, and it was a gentleman who has dementia, and he was a little agitated, getting a little frustrated. And we figured out it was because he couldn't understand her. So today we have a different person coming. My care coordinator is, smoothing that transition. And yeah, I'm hopeful all will go well today.
Absolutely. That's really cool. So are you guys primarily working with senior citizens, or what does the scope of your clientele look like?
We can pretty much work with any adult. So we've had younger people, in their 40s that unfortunately had a cancer diagnosis. Maybe they were on hospice. We had a gentleman with autism that we worked with. He was an adult and his father passed away. And so he kind of needed someone just to make sure he was showering and doing all the activities of daily living that he needed to do. He wasn't able to drive, so we were able to take him out to lunch and breakfast and go for walks and things like that. I would say probably 80% of our care recipients are probably between the ages of 75 and 100, but we do have some younger folks as well that we had a person that had a heart transplant. We have a young lady right now that just had a liver transplant, and she just got home. So yeah, we can pretty much help anyone.
And like you said, if you do have somebody that maybe does have a comorbidity, like let's say they have, like Parkinson's or MS or something like that, you may be trying to pair them with a caregiver who hopefully, has had maybe a little bit of experience with that, or at least has the skills to be able to just make sure that they're safe in their home and kind of make sure that their activities get done. Is that correct?
Exactly.
Okay.
Yeah. And sometimes when people get to a certain level, they might have a Hoyer lift in the house.
Sure.
So we definitely want to line them with someone that's used a Hoyer lift and is experienced with that. A lot of our caregivers have been CNAs or home health aides, and they've worked in facilities, for most of their life. But as they get older, a lot of our caregivers are a little bit older, maybe between the ages of 50. And we actually had one lady that's 75. And so they've worked in facilities and had their CNA, but they haven't really kept up with it as they've aged. And they just want to work one-on-one and have that relationship with their care recipient.
How does this work is it a contract? Is it a certain amount of time that somebody is locked into something like this? Or can you go week to week, month to month? What does that look like?
Yeah, we don't have any contracts. There's no down payments. There's no, set number of services. We like to at least have 20 hours a week of time with our care recipients, really just for scheduling reasons. And we like to also do a 4-hour shift just because our care providers are traveling long distances and the price of gas. It makes sense for them to be there for 4 hours. But we do have people with less hours than 4 and different schedules, but we don't have any, like I said, no contracts. So they can pretty much, if they're coming home from the hospital and they really just need a week of respite for the family to kind of get them organized until they can get there from wherever they're coming from, we can do that. There's really no limits.
Gotcha. And do you ever have the cases where maybe like the person that you guys are caring for lives here, but they have literally no other family in the state? Does that happen? Like really their caregiver is like the only person that they may have in this area?
Yeah, believe it or not, it happens more than you would think. And we also have a lot of solo agers that never had children. So we help them as well. And they really become part of the family. They're really the only person when they don't have any children, or even sometimes there'll be a niece or a nephew that will step in. But for the most part, our caregiver is kind of everything. But a lot of times when the benefit, even in my own situation, when my caregiver was staying with my dad and I was here in Pennsylvania, it was great to be able to call someone and be like, how did the doctor appointment go?
Check in.
How's the medicine going? She set up his PT. She set up his OT. She set up home health. They can really run everything as the single point of contact if you want. Of course, we don't want to step on anyone's toes. So if the family wants to do all that and just communicate with us, they can. But it's nice that you have someone that's boots on the ground, going to the appointments, seeing the progress, and can really give you that feedback, in real time.
I think it's so nice, the emotional bond that can be built through something like this type of service, like, whether it's meant to or not, but if you're spending that much time with somebody, I mean, I'm sure they become really close friends with them almost in a way. I'm sure in certain situations. I had two grandfathers that lived in Michigan, and my family's from Michigan, and they both had different types of caregivers that were with them. And I remember my one grandfather specifically was so close with the person that just came in, hung out with him, kind of very similar service to what you guys have. And it was to the point that even at the funeral, I didn't know her really well, but at the funeral, she was like right in the front, sobbing. Like they were so close friends by the end of it, that I think it was like a really emotional thing when he did pass away for her too. But it was just so nice, and it made us feel so comfortable to know that like he was enjoying his time with that person too. And just, being able to just get all of his things done without us having to worry about it at all times a day,
Yeah. So that's such a beautiful story. And it is great to see for a family member. Like, you don't really think about that peace of mind. And also the benefit of being able to be the daughter or the son and not always the caregiver is sometimes a great thing too.
Totally. And I think you do hear horror stories. I mean, I've even heard from certain clients where, maybe their parent or, brother, sister, whoever is in a home, right? And maybe it's not going super well. And, sometimes people can feel really helpless. They're like, I don't know what to do because I don't think there are any other options at this point in time. But I think depending on the situation, like if it is something where they could be home in the comfort of their home and just have somebody come to them, like what's more comfortable than being in your own place of living, right? And not something that's totally new to you with, a lot of new faces. Like there's just some people that don't really do well in those certain situations, right?
I agree. Yeah, for sure. And we actually, a lot of people think home care is just at home, but we do actually work a lot in communities, in facilities, people who are in independent living. Of course, we have a lot of care recipients in that situation, but we also have people that have maybe just transitioned into memory care. And, when you have Alzheimer's dementia, it can be very jarring for someone to be in a new environment, like you said, all these new people. And so they'll have us come where we can just sit with them and be with them all day and kind of go through their day with them, make sure, because the facilities, a lot of them are really great. They do a wonderful job, but they don't have the capacity to sit with you all day long and make sure that you're eating your breakfast and eating your lunch and getting to the activities that they provide. A lot of them will just end up staying in their room because they don't feel comfortable, getting out.
I think that's exactly what my one grandfather had. Like he was in an apartment per se where they did have skilled services. Like they did have nurses come in, check on him and stuff like that. But then he also had that other wonderful gal that would just come in and hang out with him, because we lived here. It's not like we were able to come and see him all the time. And we do have some family there, but everyone's busy and you can't be there all the time every day. So it was really nice to just have somebody, it was a peace of mind, I think, even for my parents to know that he's okay. He's enjoying himself. He's being, mentally challenged by just like talking with this person and playing cards and just things like that, but also being safe in his area and in his space. So how do things work when we are talking about like somebody who's been at the hospital and they've been discharged? Because I think from a PT standpoint, I think there's a big difference in delineation between being medically cleared and being able to independently live on your own. So how does that typically work? Like, are you guys working with social workers to like at a hospital to get somebody back into their home? How does that pan out?
Yeah, that's exactly what we do. We can actually go into the hospital and do an assessment there. We can have our nurse come in and assess them so that we know exactly where they are before they go home. We meet with the family. We talk to the social workers, kind of understand where they are. But one thing that we also love to do is participate in their physical and occupational therapy. So if they allow us to, the caregiver, and we've done this more so in rehabs than hospitals, but we will do it in hospitals if they allow it, where they will actually participate in their sessions so they can actually see, how are they getting up? How are they getting down? How are they with walking with the walker? How far can they walk? So they know before we start the case exactly what the limitations are and how they can best support them.
Well, it's probably huge for them to be able to understand their limits too. Just like if you were living with your parent or brother, sister, you want to know like physically, what are they able to do and what is a fall risk? Because I'm sure that's a huge thing for them as well. Just making sure that they're safe in their home, using their assistive devices. I mean, we see in PT all the time where, we're like, where is your walker? And they're like, oh, I left it over there. I don't need it. And you're like, I think you do need it, but especially when they're home alone, I'm sure that happens way more than we think, where they're leaving their device to the side and suddenly being put at risk for falling, and that's really not something you want at any age, of course,
Yes.
But I think that's enormous as well. So what do you think the most common type of situation that you see if someone's been in the hospital? Like, is it that end up using your care? Is it somebody who's had a joint replacement? Is it a cancer case? I'm sure you do see it all, but what's the most common, would you say?
Yeah, I would say mostly our biggest diagnosis is Alzheimer's and dementia. And then the second one would probably be Parkinson's disease. And then third would be just general comorbidities like congestive heart failure with diabetes and hypertension, kind of a bunch of things together that they're just, all kind of working against each other. Mm-hmm. But Alzheimer's dementia is probably our biggest diagnosis because along with some of that cognitive impairment comes, people forgetting to drink, and then they get the UTI and they end up with the mental issues that can come with a UTI that's gone a little bit too far, mm-hmm. or a fall risk. Like you said, maybe they normally use their walker, but they forget to use their walker, and then they have a fall and hit their head, and then they're hospitalized, and then they need someone to help them when they go home. So we have a lot of different diagnoses, but I would say that's probably the biggest one.
Gotcha. Do you guys have meetings or even like trainings? I know it's a non-skilled, so I could see where this could get a little sticky, but do you guys have trainings for your employees about how to deal with somebody that has Alzheimer's? Because I think that diagnosis can be very difficult to work with, right? Yes. Even from the PT perspective, if we have somebody with Alzheimer's, it can look so different. They can get frustrated very easily. And I totally understand, because if you are confused, I would be frustrated as well. Yeah. But or is that something that they're learning through maybe their other training, through their independent work?
It's kind of a combination of both. So they'll, maybe they have a CNA license or a home health aide license, and they've, learned some of that and had on the job training. We provide resources on our website for our caregivers. We do have a dementia training kind of program they can go through that's available. We work with outside providers that do that training that we might, recommend to them as well. And then my care coordinator, who is a CNA, also has a lot of dementia experience. So if we're having an issue with the client, she'll go out and we do a hands-on skills assessment as well as a written skills assessment. So we kind of know their limitations beforehand, and we talk to them, of course. And if they, have had a lot of dementia experience and they feel comfortable, we'll assign them to someone with dementia. If not, usually we would put them through the training, but we still wouldn't assign them to someone until we felt really good about their skill set.
Got it. Okay. Now, if I'm if I'm just a PT working in my clinic, or an OT or speech pathologist, whoever you may be, if you are working with somebody, like let's just say an older adult in general, and maybe their family's coming in, and you feel that they live alone, and you're like, okay, I don't think they are safe, or I don't think they are maybe taking their medicine or something like that. Do you suggest that we bring that up to the family? Like, hey, this is an option, just so that you are aware of it, that you could have somebody come into the home to just be with them. Is that something that you would suggest?
Yeah, I think that's a great suggestion, because I think it kind of takes a village, right? So a lot of times you're not with your parent that much because, like, you said, maybe you live out of state or you have a job and children. And so you're seeing them here and there, but you're seeing them at different snippets of time when they seem completely fine. And so other people are seeing them maybe at times and noticing things that maybe as a child you really don't notice. So I think bringing that up is always super helpful. Sometimes, of course, nobody wants to admit that maybe they're needing a little bit more help, but getting ahead of it can make things so much easier. And sometimes, you might be seeing someone for an injury, and once they get through that injury, kind of like my dad, they're back on their own for a few years until something else might creep up. So sure. I think the more help you can get someone to stabilize them sooner, the better recovery and outcomes they're going to have.
Sure. I think it's funny because I personally have this clients that, maybe telling us things about their home life. Like they're like, oh, I never use the walker, or I don't need that pill, or I drove to get my groceries today and I'm not supposed to be driving, and they may tell me like, oh, I'm not telling my kids that. Like, why would I tell them that? I don't, part of it is, are they embarrassed about it? Is it just something that they don't want, a nagging, daughter or son to be asking them about it?
Yeah.
And that's the moments where I'm thinking like, is that part of our duty of bringing it up at least to someone in their family, just to say, hey, just want to let you know, like, it may be a good idea to like look into it, to have somebody there if they're unsafe, right? And if they may need that service. Mm-hmm. Now, is the type of stuff that you offer, again, it's non-skilled, so I can't imagine it's covered by insurance. Is it primarily a cash-based service?
Yeah, so we do take long-term care insurance, and we have quite a few of our families that have long-term care insurance, and we're happy to facilitate that whole process. So we'll call the insurance company, understand the benefits. Typically, they'll need to approve us, so we'll send them our PA home care license, whatever other information they need from us in order to get approved as a provider. And then they'll typically require us to send our invoice and then what's called daily progress notes or care notes. So every time we go in to visit with one of our care recipients, we've got a set list of things based on our care plan that we are doing for them on a daily or weekly basis, depending on how frequently we're visiting. So based on that, a lot of insurance companies will require you to need assistance with at least 2 of the activities of daily living. So bathing, dressing, feeding, toileting, ambulating, things like that. So as long as they need that assistance and usually they'll have an assessment on their own to identify that as well, they'll cover the service. So some people, it'll cover a certain amount per day. Sometimes they'll cover the whole day. It really depends on your plan. Mm-hmm. And then we're also approved with the VA. So anyone that has VA benefits for home care, there's a little bit of, intricacies there based on what benefits you get. And we're happy to walk them through that as well. But the VA will cover certain visits as well. So we probably are, I would say, 60 to 70% private pay, and then the rest have some type of insurance or VA benefits or things like that.
Okay. Is it more cost effective, you think, to have somebody come into a person's home compared to living in like an adult senior community where maybe there's not a skilled or non-skilled service offered? Because I'm sure those places could get pretty pricey just in general. Do you know, like the place I'm talking about that, maybe they have like a cafeteria and stuff where it's easy to get food and stuff like that, but there's not necessarily someone coming in to check on those people. Do you think it's more cost effective what you guys offer?
It really depends on the level of care. In most cases, home care is cost effective. That's kind of one of the myths where people think like, oh, I could never afford home care. We'll just do the facility. That way I know someone's around 24 hours a day. And for some people that's great, but you really have to understand every community is different. Some of them you put down payments down. Some places include food. Some places you include a certain number of meals. Certain services are included. Some are not. So you really have to look into the, fine print and really understand each of the communities and what they offer based on what you need. But typically, if you're just starting out, home care is more economical because we can customize it. You're not necessarily paying for everything, but maybe you only need help 3 days a week from 8 in the morning till noon. That's going to be a lot cheaper than paying a monthly fee for a facility where you're getting, or a community where you're getting all of those services that you just might not need.
It seems really personalized from what you've been saying, like what you just said. Like it's not like a certain rate that you have to be using all of the services that you offer. It's just kind of what the family and what the individual needs at that time, right?
Right. Yeah. And it's so much. The other thing is, a lot of people think like, oh, I'm going to lose all my independence. Someone's going to come in here and start telling me what to do. Right. But we really just want to support them where they are. And they actually have more independence because a lot of facilities, if you are using the personal care, showers are Thursday and Saturday. And if they come for your shower and you don't feel like showering, you're pretty much not getting a shower until Saturday. Mm-hmm. Each community might be different, but most of them are pretty set in what they can offer. So families at home, maybe you want to shower at night, or, you don't feel like eating breakfast until 11 and you want to have eggs, or whatever you want. We can pretty much just customize everything to what that person wants or needs.
Do you guys offer services in the palliative care or hospice care space?
So we don't do those services, but we work alongside them.
Right.
So yeah, that's another, kind of thing. A lot of people think, oh, my loved one's going on hospice, so they're going to take care of everything. They're going to come, they're going to do everything we need. But really, hospice services are great, and they do provide usually an aid for bathing a couple times a week. There'll be a nurse that will come. They have social workers. A lot of times they have music therapy. They have so many wonderful services, but they don't have someone there all day. So if you have someone who's really, in the late stage of cancer or some type of disease where they can't get out of bed,
right.
They're not changing them every couple hours or moving their position or just sitting there holding their hand. They're not doing those types of services. It's just, set services a few times a week.
Okay. I want to talk about caregiver turnaround, because I think in this industry that can be a big issue, right? I think I was reading it could be like up in like the 60% range where in a year, a business can lose a caregiver and then new people come back in.
Yep.
What do you think is the reasoning behind that, or like a flaw in this industry that hopefully, depending on where you work, it will be addressed, or, ways that you can support caregivers to be wanting to stay working for your business?
Yeah, so we've been really lucky. We do not have a ton of turnover. We don't have a lot of call outs. Our caregivers are pretty dedicated to us. I think one is the pay. We do pay higher than most agencies just because we want to attract more seasoned, more reliable caregiver. So I think that's one thing. The other thing is really the shifts. So I think we talked a little bit about this, that a lot of times people say, oh, I just need someone to come and help my mom with a bath for an hour. And how much I would love to do that. I wish I could physically go to everyone's house and help them with, a bath that they needed. But the reality is these caregivers, this is their job. They're trying to make a living, and they can't live on, 4 hours a week or 5 hours. A bath for an hour a day just isn't going to work. And gas is so expensive. So they're driving from place to place to try to make a whole day worth of work for themselves. So what we found is the longer shifts, matching a caregiver to a family, and they're really their person. Like some agencies will send a different person every day because they're just trying to keep their census as high as possible, fill as many hours as they can, where we just want to meet a family, understand their needs, assign them a caregiver, make sure that's all going great, and then, kind of move on to the next one. We can do it simultaneously, but we like to make sure it's a really good fit. And so our caregivers tend to stay longer because they have longer shifts, especially, I know we touched a little bit on the live-in, but these live-in caregivers actually move in with the family and they'll stay for years. We had multiple cases where people have lived with the care recipient until they passed away for 2-3 years. That's longevity for that care provider. They know they're getting a steady paycheck. They have a wonderful family. They really, as we talked about, get attached to the care recipient. So it's not really a job for them. It's kind of a calling. So as long as you treat them like, they're super valuable, which they really are. They are the heart of our business, and we try to show them that whenever we can. You shouldn't have too many issues with turnover.
They seem in a way like the face of the business for the most part, which is huge. How do you guys vet the caretakers?
Yeah, so we have a really strict vetting process. So last year, we had 205 applicants, 217 applicants, and we hired 25 people. Wow. So the initial, people fill out an application, and then we have kind of an initial background check that we'll do through some sources that we have. And so they may not even get through that first cut. So if they make it through the, just preliminary, background screening, then we invite them for an interview. They have to do a face-to-face interview with us. Once they get past the interview, then we call their references. So they have to have at least 2 positive references. We like more. It has to be from a family member, that they've cared for. So son, daughter, niece, nephew, or a supervisor. So we really want to talk to someone that's actually worked with them. And, sometimes we'll get people that are just a colleague or someone that, may not know them that well. But we have a very long list of questions that we ask as well. How do you know the person? How long did you work with them? What exactly did they do? So we really understand their background. We don't accept any references from, a lot of places will just say, send us a fax and we'll verify when they worked for us. We don't I mean, we care that you worked where you say you worked for whatever time, but we really want to know, what kind of person are you? Were you reliable? What did you do? Would you hire that person again? Like, we really like to talk to another person. So sometimes they just can't produce 2 references, and they might be a phenomenal caregiver, but we won't move forward if we don't have those 2 references. And then we do an official Pennsylvania background check, and then a background check from a third party that is nationwide. So anywhere they've lived in the country for the last 7 years, and then we repeat that every 2 years.
What's the age range for some of these caretakers? I mean, are we talking younger folks, older folks? What does that look like?
We have a wide range. We've learned very early on not to discriminate based on, age, sex, any of that. Like, we have some of the most amazing caregivers that you might not have expected them to be great. So we give everyone a fair shake. Yeah. I would say most of our caregivers are probably between the ages of 45 and 70. We like to work with the more seasoned caregivers, especially in home, because they are by themselves. There's nowhere for them to ask, where if you're working in a hospital or facility, you can just walk down the hall and be like, can you help me with this? What do you think about this? Like, for the most part, they're on their own. They can always call us for any questions or advice, but they really have to be able to think on their feet. But having said that, we've had, I had a gentleman that was 19. He was in school to be a kindergarten teacher, and he was one of our best care providers. He spoke at this gentleman's funeral.
Oh my gosh.
Yeah. I mean, he was just we used to call him Kevin from heaven. He was just amazing. But you wouldn't think a 19-year-old boy would be one of your best, caregivers. He did get his degree, and he, is now an official kindergarten teacher.
Well,
but
shout out to Mr. Kevin, who's probably the kindergarten teacher.
Yeah, he's phenomenal. So,
that's so sweet.
Yeah. So, so we have, great stories of our care providers of all different ages.
Yeah. So you mentioned when you were first looking into, like, okay, I want to go into the home care business, which, first of all, did you ever think, like 20 years ago, that you would ever be in this position?
No, I really didn't. I mean, believe it or not, my undergrad degree was in health administration.
Oh.
So, and I did work in a nursing home very briefly for an internship one summer. But it was more on the administrative side, not, taking care of patients. But I've always loved seniors. I think they're just adorable. I know people love seniors, some people don't, but I just love them all. I think I see them walking into the store, and you just want to go and chat with them and help them. So it's not something that I ever thought I would be doing, particularly after working, with numbers and money for so long. But it's been amazing. And I always kind of think about this quote from Pablo Picasso, which I'll probably screw up, but the meaning in life is to find your gift, and then the purpose in life is to give it away. So I really feel like I found something that I really love.
Absolutely. I am with you. I love senior citizens. Like, even some of my favorite clients are my senior citizen clients, because there's times where I think from a therapy aspect, like, yes, we're exercising, we're trying to get you strong, we're trying to balance you, but there are some times where I can just tell they just want to chat. And like I was telling you, I love to chat too, but I could chat all day. But we'll just chat, and suddenly 20, 30 minutes goes by, and I'm like, we haven't even exercised. I can't even bill for this. But it just makes you so happy, because I'm like, I hope that this was one of the best parts of their day, and I hope that from a therapy standpoint, that's what they're here to do, right? Like, you are being driven to this clinic to work out. Sometimes they're being brought against their will. Maybe they don't want to exercise, but if I can be something that puts a smile on their face, and later when they're eating dinner, they're like, I'm so glad I went to physical therapy today. Like, that means I'm doing my job correctly. You know what I mean?
Yeah.
So it's really special. So you had mentioned that when you were looking into getting into the franchise business, you looked at a couple different places, and you did mention a little bit of why Senior America, but I want to know a little bit more. Were there other things that really drew you to options for Senior America?
Yeah, I really loved that it was small, a small franchise. So you really got to know the owner. We really got kind of one-on-one training, with the owners of the company. Like, my franchise training day was with the 2 owners, and they, told us their experience and really spoke from the heart. And they were so passionate and involved in the business. Where some of the other franchises I looked at, they were more just, it was a business. They wanted to build as many franchises as they could and get as many people in and out the door as they could. And I just loved the personal aspect. And we had our franchise conference this past week, and the owner actually came back. They sold the business to 2 new people, and just talking to him, I was like, Ramsey, you're the one who really sold me on this. I mean, just such a heart and a passion for what he does. And, he said, I just really want something where at the end of the day, I feel good about what I did. And, I feel like we really aligned on that.
Absolutely. Do you have any other examples of, maybe just stories you hear in your workday that just reminds you of like, this is why I do what I do. And like, I just love this business so much. I know you mentioned Kevin from Heaven.
Yeah.
Teacher Kevin. Are there other examples that you'd like to share that would just really hone in with why you do what you do?
Yeah, I mean, I almost feel like every day, sometimes as the owner of the business, I get a little bit removed from the actual care that we do. I'm hearing about it and looking at it and talking about it, but I'm not physically doing it or meeting with the care recipients during that process. So whenever I have the opportunity to do a skills assessment, or we do go out and meet with our families, usually every 60 to 90 days, and see how things are going, how the caregiver's going. Every time I do that, I think this is why I do this. Like, I love to just see our clients and hear all the wonderful things that our caregivers are doing to support them. Not long ago, we had a family, a husband and wife. They were both in the hospital. They both came home. They were in a community, and they asked us, we had taken care of them before they went into the community, and they were good for a while. And so the family called and they're like, we're in a panic. They're coming back. The facility won't let 2 of them on hospice back by themselves because we can't take care of them the way they need to be taken care of. So within, I want to say 24 hours, we had a 24-hour team set up for them. Myself, my care coordinator, we went in, we cleaned the entire apartment. They delivered the bed. We set up the bed. We made the bed. So like, they came in and that room was like, oh my gosh, spotless, perfect. And I was like, this is why I do what I do. Yeah. It's not like about the money. It's not about anything but like just trying to make an impact
and make their lives a lot easier, especially like I said earlier, like in certain situations where it can be very stressful.
Yeah.
So what are some of you mentioned a little bit earlier with like the home or the hospice care stuff, but what are some of like the biggest misconceptions about what your caregivers can and cannot do? Like, do you have families that are like, oh, I thought they were going to do that, but they can't, depending on what their non-skilled role is?
Yeah, no, we usually set that out right at the beginning of like what we can do and what we can't do. So we don't really have any, usually everybody know, and we have that detailed care plan that everybody is kind of aware of like, these are your needs. This is what we're going to do. So yeah, and if they need a driver, we make sure we have someone that drives. We check their driving record, their insurance, all of that. So yeah, there's usually not any surprises from that perspective.
And then are there ever like progress assessments? It's something that you may attend, where you're going to the home, just like checking in, or someone in your business is checking in just to see how things are going. Are we liking it? Do we need to change anything? Do you guys do those? And if so, how often?
Yeah, so we usually have a process. The first day we start a case, most of the time myself or my care coordinator will go and just make sure everything starts off on the right foot. My care coordinator usually knows like more from the medical side, and if for whatever reason the person hadn't changed a catheter bag, she can quickly show them, how to do that. So we make sure everything's good there. And then I'll usually always call the care provider and the client after the first visit. How did it go on your end? How did it go on your end? Making sure everything is, any feedback we can relay back and forth. And then we'll usually give it a couple days, follow back up. The first week is usually critical, a few different touch points. Once the case is kind of humming and everything's going well, the care providers will give us notes every day. So we'll read those, see if anything pops up there. And then we'll do a 60-day assessment for our personal care cases, and then a 90-day for our companion cases, where we just go in, like you said, how's everything going? How's the care provider going? Has anything changed from a care plan perspective, and kind of evaluate that. And then we pretty much, we'll take any feedback. Sure. Anyone can always call my cell number. The office number goes right to my cell.
Do you think there's situations where families may not know that there's actual like entities that run something like this, and they just try to contact on Google like a random independent contractor, home care person. Does that happen? Do you think?
Yeah, we see that a lot. A lot of times it's almost like, like babysitting, where
Right.
you're looking for someone to just kind of stay with your loved one, make sure they're okay.
Right.
In most cases, maybe you'll find a neighbor or someone
Sure.
like that. It works out. Usually when it's a more consistent case where you need someone every day, long hours, live in, you definitely want to go to an agency.
Right.
A lot of the long-term care insurance providers will not pay unless you're with licensed home care agency.
Got it.
So that's something to think about. And really just the insurance. I mean, we provide workers' comp, liability insurance, we're licensed, bonded. So if there is any issue, you're covered just through our company, where a lot of times people don't think about that. And just paying the caregiver too, of course, a few hours a week, you're fine. But if you're paying someone full time, you've got all the, domestic employee taxes, all those things to worry about. So we take care of all that.
Well, and I think a family would really appreciate the vetting process. Like you said, it seems so extensive, but it's extensive for a good reason, to just make sure you're getting the right people. Not saying that there's people there that are there for bad reasons, but I think you guys take that approach a little bit more seriously, just being able to place the right person with the right family and with the right, individual that they're working with too, which is huge.
Yeah.
Because again, I don't think you want to be going on Craigslist, like looking for people like, hey, can I look for you? Excellent. So I was just going to ask you a couple other little closing thoughts. Doesn't really have anything to do with what you actually do day to day for your business, but what do you like to do to recharge?
Well, let's see.
What do you do outside of work?
Yeah, I'm a big outdoor person, so I do a lot of running. I'm kind of on this quest to do the marathon majors. So I've done 5 of them. 4 of them. I have 2 more, London and Tokyo. So that's kind of my full-time non-working job. And then I've recently taken up golf, and I absolutely love playing golf. So that's
so amazing. Wait, so what are the 5 majors? I'm not familiar.
Okay, so I think there's 6. So New York, Boston, Chicago, London, Tokyo, and I feel like I'm missing one.
But you've done all the U.S. ones?
Yeah, I've done all the U.S. Oh, Berlin I did last year, yeah.
What?
Yeah.
Oh my gosh. So, have you been a runner your whole life?
Yes and no. I ran in high school, track a little bit, but, not seriously. And then I really didn't run very much, a little bit in college, a few miles here and there. And then after I had my kids, I joined a running group and just started, it was more for social reasons, friends, and just, loved it.
Oh my gosh.
Kind of
That's amazing. One of these days, I will run it. I'm going to make sure this is on the recording. I will run a half marathon one day. One day it will happen. And now I have it on here. So it's going to happen.
Yeah.
Are you originally from the southeastern Pennsylvania region? Did you grow up here?
No, I actually grew up in Boston till I was about 12. Then I moved to Illinois, went to college there. Worked in New York briefly and met my husband, went back to Illinois, and then we relocated here to be near his family.
Where in Illinois did you live?
I lived in Buffalo Grove, which is kind of the northwest suburbs of Chicago.
Gotcha. I was born out in Geneva, which I believe is west of the city.
Yeah.
Midwestern girls. I love it. And when you worked in finance, were you in New York at that time or kind of all over?
Yeah, all over.
All over. Gotcha.
Yeah.
Oh my gosh, amazing. Well, I cannot believe you ran so many marathons. That's so cool.
Oh,
so
thanks.
My last little thing is just, can you let people know where to find you, if they're looking for your services?
Yeah, sure. So our office is in Wayne. Do you want me to give the phone number?
Sure.
Okay. So you can call us. It'll go right to my cell phone, 610-975-4422. And then we're online, our website, www.options.com.
Excellent.
Yeah.
Well, Christine, thank you so much for coming today.
Much.
And so glad we got to learn all about the in-home services that you guys provide. And then we'll see you guys next time. Keep learning, keep moving. Bye.